Dr. B. Clay Keith and Dr. Paul Denson produced this video to answer the many questions you may have about renewing your smile with the latest fixed dental solutions.
Hi, I'm Laura. Welcome to the Dental Digest. The American Dental Association indicates there are more than 30 million people in North America with all of their teeth missing. For those patients wearing a temporary and often uncomfortable solution, like dentures or partial dentures, quality of life is often greatly reduced. In this episode of the Dental Digest, we will look at the latest dental implant technology for people with missing teeth and how a procedure called All-on-4 is making new, fully functioning smiles a reality. All-on-4 is a unique solution, transforming your loose-fitting denture into a fixed, stable denture utilizing as few as 4 dental implants. After the procedure, you can eat, speak, and smile with confidence.
Before, it was a nightmare. I thought I was going to have a heart attack, in plain English, because no matter where I was always afraid that my front teeth would fall out. One day in the beauty parlor, my teeth came right out. Another time on the plane, they fell out.
I was in really bad shape, so I actually don't look good at all. I was embarrassed of smiling, I was embarrassed of laughing, I was embarrassed of even talking to people. It was a disaster.
I had the dentures, I didn't like them, they didn't fit right, they didn't stay in, you can't eat, you can't taste anything. It was horrible.
Many people wear conventional dentures. A full set of dentures allows for only 10% of the chewing capacity compared to a person with a full set of natural teeth. This means a softer diet, which may eliminate some of the foods you're accustomed to eating. With the All-on-4 procedure, you can regain your self-confidence and 70 to 90% of your chewing ability. Eat the foods you once enjoyed.
With the All-on-4, I walked in with a mess, I went to sleep, and when I woke up I had teeth. It's great. I mean, it's just something that I will enjoy forever. I can eat, and I do enjoy eating. And it's just terrific. Very happy I did it.
Before I had the All-on-4, I had a partial bridge. It was very unsatisfactory because it was very unstable. It was rocky and I couldn't bite very evenly on it. It jiggled around in my mouth, actually. It was uncomfortable. The All-on-4's made a difference to me because I don't need to worry about my dentures anymore. I don't need to worry about what I'm eating or that I'm going to have to be sitting with some lettuce underneath my bridge.
The adhesives to keep dentures in place are also a hassle to manage and not 100% effective. It's no wonder denture wearers are extremely self-conscious and reluctant to socialize.
I hated the polygrip and the Fixodent and all that. When you take them out, you have to pick the stuff off the roof of your mouth, and you have to pick it off the denture. It's a horrible experience. So I would generally go without, and occasionally, and you couldn't quite tell when or why, but you would be saying something and they would just drop, and it affects your whole speech pattern, and it's obvious to the person that you're speaking to that you've had some type of accident, and it's not pleasant.
It's a common complaint. Without natural or artificial tooth roots, your jaw will begin to shrink due to bone loss. This will cause your dentures to become ill-fitting and slip, making it difficult and painful to eat.
I didn't like the way my face looked with dentures. This totally just changed everything. When I had dentures, my lip seems to droop on one side especially, went lower than the other side, and it just changed my whole appearance of my face. A lot of people didn't see it, but I saw it. And then when I got the implants, it seemed like I went right back to the way I used to look.
Over time, a shrinking jawbone ultimately changes the shape of your face. Your mouth and jaw could appear to collapse, your lips will seem thinner, and your skin will begin to wrinkle, especially in the areas around your mouth and neck. Without an adequate amount of bone, it will be difficult to wear dentures, and eventually, even dental implants might not be a viable option. Placed early enough, dental implants can help prevent jawbone loss and preserve facial contours.
The All-on-4 procedure, or another name for it's teeth in a day, is a procedure that where a patient comes in, we actually perform their implant surgery same day. They leave with a fully functional set of teeth screwed into their mouth that they leave with the same day of surgery. What's neat about the procedure is, it's done in one day. Where used to this was a long, drawn-out process, and it was a big turnoff for patients, and it would take up to a year to complete. And now we've through Noble Biocare and this new technique, we're able to place the implants the same day, and they leave with teeth screwed in.
No, most patients that have this procedure are amazed that they leave with little or no pain the following day. In fact, most report only taking ibuprofen or other over-the-counter medications, although we do prescribe patients stronger medications.
But I woke up that day with teeth in my mouth, and I went home, I wasn't even swollen.
I thought that I was in for a rather long, painful experience, and I was proven wrong.
I would say in the long run, no matter what you go through, it is worth it.
I'm happy with them, and I would do it again, and I don't think there's any greater endorsement you can give than that.
The all-in-4 process surprised me because it was so quick. It took only maybe 6 hours to be completed, and I was surprised how quickly I recovered from it.
You get your life back.
The Center for Implant and General Dentistry is committed to providing high-quality, technologically advanced treatment plans for patients that want to improve their smile and their quality of life. Dr. B. Clay Keith and Dr. Paul Denson's collaborative relationships with Texas's premier restorative dentists have ensured thousands of successful implant procedures. To schedule a consultation as the first step toward experiencing the life-changing effects of All-on-4, please call the Center for Implant and General Dentistry or visit www.lindaledentists.com.